Welcome to another episode of Speak to the Gynecologist. In a recent video, we discussed fibroids, and today, as a follow on from there, we'll talk about fibroids and pregnancy. Um, People are always worried whenever there's fibroids. Women either trying to get married or trying to get pregnant worry about the effects of fibroids. Uh, the issue is that fibroid has fairly overreaching effect on all aspects of pregnancy, beginning from fertility to early pregnancy, late pregnancy, childbirth, and the postpartum period. We'll try and briefly describe the implications of fibroid in each of these phases. For instance, with fertility, there's always this question: uh, do fibroids cause infertility? My answer is a small yes and a big no. Why? Most fibroids do not cause infertility. For fibroids to compromise infertility, it has to be basically on the location and the number of fibroids. For instance, the fibroids that are low down in the cervix might interfere with sperm movement. And if you have fibroids near the entrance of the tube, they too can interfere with sperm moving into the tubes and might affect a woman's chances of getting pregnant. Or if you have too many fibroids filling the womb, which is not very often. So on those occasions, fibroids could uh, cause infertility, but it's rare. So quite often, people are not fully investigated, and usually when infertility is being managed by non-specialists, then they tend to hang on to every small detail they see and blame it. Before you can start managing infertility, you have to do a thorough investigation and check out all the things that are necessary before you can blame anything. But fibroids do affect pregnancy. It's when you get pregnant. We'll take it in three phases of pregnancy. The first trimester, which is from beginning of pregnancy to 14 weeks. The second trimester from 14 to 28 weeks. The third trimester. In the first trimester, fibroids can cause miscarriages, starting from what you call chemical pregnancy. Sometimes you do a pregnancy test, it's positive, but when you do a scan later, there's nothing in the womb, which means that the fibroid being there didn't allow the pregnancy to implant on the lining of the womb. This happens very early. And most times, if you don't do a pregnancy test, you may not even know that you are pregnant. But some women do. That's called chemical pregnancy. Depending on the location of the fibroid, if fibroid is where the pregnancy is trying to implant, it may not allow it to implant on the lining of the womb. That's one. Two, the fibroid occupies part of the space meant for the pregnancy. Either the one growing in the womb or even the one growing in the muscle can be so big it will obtrude into the cavity and distort the cavity. That could lead to miscarriage too, usually in the first before 12 weeks. So this too can happen. There are three things that can happen. The chemical pregnancy, where the pregnancy fails to implant, even though you missed your period, have a positive pregnancy test, or a woman keeps having miscarriage around the same 8 to 10 weeks, and you can see a fibroid inside. It's very subjective. There is no objective way of confirming that yes, this fibroid is causing miscarriage. But if it's happened twice and the fibroid is there, we tend to assume that it could be responsible. In that case, we recommend removal of the fibroid. In the second trimester, that's from 14 weeks to 28 weeks, similar things can happen. Fibroid, if it's very big, might interfere with the implantation of the placenta. So the placenta might either implant on the fibroid, or because the fibroid is pushed downwards and it implants what you call low-lying placenta or placenta previa. When the placenta implants before the baby, a woman tends to bleed during pregnancy, and such women end up having a cesarean section because the placenta is coming before the baby, and you cannot deliver the placenta before the baby. So you have to section them because some of them bleed around 4 to 6 weeks before pregnancy. So it might be an emergency section or an elective section. Fibroid itself, too, if the placenta implants on the fibroid or part of it, it doesn't get enough blood supply because part of it goes to the fibroid. So two things can happen. The placenta can detach, what you call abruption. It can happen anywhere from from 20 to 28 weeks. Placenta can detach, woman will bleed inside, the baby will die, and sometimes you have to operate, do a cesarean section to get the baby out. Sometimes the woman will start bleeding, and then you take her to hospital. Sometimes the babies don't grow well because fibroid interferes with the blood flow through the placenta to the baby. So such children, they might be delivered by what you call small foldate or what you call intrauterine growth retardation (IUGR), all caused because the fibroid has interfered with the blood supply to the baby, interfered with the space. The baby has a smaller space to develop it because there are fibroids now taking up part of the space. Sometimes the fibroids on the outside, we want to call pedunculated, they can run out of blood supply coming to them. So they begin to necrose inside, and that can cause severe pain during pregnancy. You have to admit them in the hospital. It's not an infection, you just need management. They get better, they get well. Very rarely, it can twist what you call a torsion on the neck, and it becomes an emergency where it has to be removed, but that is very, very rare. In the third trimester, it's a similar thing. If fibroids are lying low down, they don't allow the baby to come down. The ones inside the cavity, distort the cavity, you have what you call malpresentation. The baby doesn't come down with the head. It's either like coming with breech or lying transverse. At the end of the day, those babies have to be delivered by cesarean section because it cannot go down into the back passage because the fibroid is obstructing the way. Baby is not lying properly. And if baby is not lying straight, it cannot be delivered vaginally. So such women tend to have more chance of cesarean section than those who don't have fibroids. Thirdly, during childbirth, fibroids don't allow the womb to contract properly. So women who have fibroids tend to have what you call failure to progress. You assess a woman every 4 hours during labor. You find that after 2 or 3 assessments, she's made no progress because the womb is not contracting properly. And because of the fibroids are there and they're affecting the womb, the contractions. So there's a higher rate of cesarean section in women with fibroids. And lastly, after delivery, the womb does not contract very well. So such women tend to have what you call postpartum bleeding. So that any woman with fibroid is advised to register in a facility which, where there's a specialist one, facilities that have a provision for blood transfusion, for management of cases who might bleed. Just going to a small private hospital may not be advantageous to you. Rather than that, go to a general hospital. There's bound to be a specialist. But if you're choosing a private hospital, choose one where there is a qualified gynecologist in a decent hospital, somebody with a reputation, you know, that can manage such things. So to recap, fibroids can affect fertility marginally, but they affect pregnancy more. In the first trimester, they will cause chemical pregnancy, they will cause miscarriages, they might equally cause bleeding. In the second trimester, they can cause premature labor, and in the third trimester, they can cause abruption of placenta, malpresentation, cesarean section. And in the postpartum period, they might cause heavy bleeding, what you call postpartum hemorrhage. So I advise sadly that if you know you have fibroids and you're pregnant, try and look for a specialist to register with. If you're registering with a private hospital, or go to a general hospital or a teaching hospital, because there's bound to be enough provisions to manage such cases. And there will be somebody experienced enough to do a cesarean section for you if you require one and give you the requisite advice postpartum how to manage yourself. Thank you. Yeah. If you like this video, please leave your comments or questions. I'll make sure I answer them. And watch out for the next video coming very soon. Thank you.